Welcome back to Aggies Talk Health, brought to you by the Student Health and Counseling Services and the Student Health Advisory Board. I'm your host, Aruna Nannapaneni, and today we're talking about optometry services provided here for students at UC Davis. And we have our amazing optometrist, Dr. Melissa Barnett, here to talk to us about all the resources students have. Thank you so much, Dr. Barnett, for being with us here today.
Thank you so much for the opportunity. It's a pleasure to be here.
And to get us started off, I wanted to learn a little bit more about yourself and what got you into optometry and why you wanted to work with students as an optometrist.
I'm Dr. Melissa Barnett, and it's such a pleasure to have a clinic here. We started the clinic 12 years ago, actually, as an opportunity to really help students. I've been practicing for many years at UC Davis Health, and we started this clinic on campus through UC Davis Health. We provide all sorts of services for students, so it's wonderful that we can be here on campus, really close and convenient. We offer primary eye care, so comprehensive eye exams where we dilate the eyes to check the health of the back of the eyes. We have a great optical department with sunglasses and all sorts of glasses as well. We also provide services like acute or emergency eye care. We see lots of things like foreign bodies in the eyes when students are biking. When they get something in the eye, we can remove that just right on the spot. Lots of eye infections, also trauma. We also work closely with athletics to help athletes as well. So we're here really to help all students, especially people who have not had an eye exam. It's really important to have an eye exam to check the health of the eyes.
And it's so interesting. I didn't realize that you also come to optometrists for like the acute care aspect as well, not just checking your eyes.
Yes, we work very closely with primary care and acute care. So oftentimes the students come in the same day to one of those services. We are always here to help.
And why do you think eye health is so important specifically for students? Because I feel like when we think about like, oh, your physical well-being should be good, we don't always think about our eyes. I think we often overlook eyes, especially students.
As students, there's so much that you're doing all day long with your eyes. On computers and digital devices, reading, constantly using your eyes, and I would say day and night. And so do you stay up late at night and study? So it is important to take breaks when on digital devices. So blinking the eyes every 20 minutes, looking 20 feet away for 20 seconds. That's the 20-20-20 rule. It's very important to have the prescription fully corrected in order to see clearly. But it's also really important that eye health, I would say, is the most important because of all the digital device use. We don't blink as much on digital devices. So we blink about 60% less, actually. And in order to see clearly and comfortably, having a smooth ocular surface is quite important. So something we see very often here is dry eye disease, meibomian gland dysfunction, where the oil glands get plugged up. And we also see all sorts of things here in this population that aren't diagnosed in other places. So for example, keratoconus, which is a condition where the cornea, the front surface of the eyes, is more curved. And there's a great procedure to strengthen the cornea. It's very prevalent. 1 in about 300 people have it. And it's most prevalent in this age group. We can go on, but there are many different conditions. But in order for students to perform at their best, it's important for their eyes to be working as well as possible.
And it's really cool having a clinic that specifically knows about conditions for students. So when you go outside, maybe they don't understand student health as much as our clinic here.
Yes, and the unique thing here too is that it's a very international population, which I always enjoy because I learn about eye care practices all over the world by seeing students here.
Are there anything that's coming up in fall for students as well?
Something that's really exciting is it's called ABBY, ABBY. So it's an online contact lens ordering system where students can order contact lenses 24/7. So all day, all night, all that's needed is a valid contact lens prescription. So a student does not have to have an eye exam here. But as long as they have a valid contact lens prescription, then we can incorporate that into our system and contact lenses can be ordered at any time. So that's a great new service that we have just to make it very convenient for students to order contact lenses.
And I was wondering if your services are different for students who have UC SHAB and students who don't.
We actually serve all students, so everyone is welcome. So we see a lot of students who do not have UC SHAB, especially for the emergency eye care services.
How do students sign up for an appointment?
There are various ways that can be done online for a comprehensive eye exam. A student can come in to our optical department and look for glasses and also schedule an appointment at the same time or call. So there are multiple ways to schedule an appointment.
Okay, so you go straight in through optometry. You don't have to go through primary care first to get your services.
Correct. You can just sign up online.
And this is regardless of insurance.
Correct. Yeah.
And is there anything else that you would like to add for our students?
Sure. So we have all sorts of services. So some things that are really fun right now are different contact lens technologies that we're using for things like headaches and migraines and athletics. So this is unique and actually quite new. We have all the latest and greatest when it comes to contact lenses and also glasses. Another thing that a lot of students ask me are which products should I use? Like what mascara is safe? What facial products are safe? And I think that's very important because the ingredients in the products, many of them are toxic and they can actually affect the ocular surface. In order to prevent, say, dry eye disease and prevent contact lens discontinuation or dropout, we do have recommendations of safe and healthy products to use. Another thing that we offer here at the pharmacy is all sorts of safe products that are over the counter. Eye drops, artificial tears that are safe. There have been a lot of recalls in the last year, but everything we have here is safe and healthy to use. We also have eyelid cleaner, and that's like brushing teeth, cleaning eyelids. It's important for good eyelid hygiene, and we do have eyelid cleaners here in the pharmacy as well. And Davis, has so many allergies, and we have over-the-counter eye drops for allergies. So we have a lot of services in pharmacy. And so if you're wondering, what is something safe to use, feel free to stop by the pharmacy as well.
So you're mentioning different chemicals now that irritate your eye in terms of makeup and all different products. I was wondering if there's a way students can find out about what they can use and what's safe and what's unsafe.
Yes, so there are many products that are harmful to the ocular surface. So the best thing to do for a student is to come in for a comprehensive eye exam, and we can go over different ingredients and different products and give specific recommendations.
Is there any way that students can do eye exercises or anything at home that makes sure that they have strong eyes and they're keeping everything in check?
One is the 20-20-20 rule. So every 20 minutes, looking 20 feet away for 20 seconds and blinking the eyes. So that's something that is very important. Also, it's great to wear sunglasses outdoors for everyone to protect the eyes from UV light. A healthy diet is also a very good thing for the eyes. So a non-inflammatory diet, avoiding a lot of fried foods and fatty foods are healthy for the eyes. Drinking water, having some caffeine but not too much are also good tips for the eyes. But I'd say the most important tip is to have an eye exam. So a comprehensive eye exam, we can find more than 270 diseases in the eye. These are not just eye diseases, but they're systemic diseases that go along with the eyes.
That makes sense. I was reading on your website that the eye health is connected to other parts of our body as well, such as getting an eye exam can help you learn about diabetes.
One thing we see often here is multiple sclerosis. Any sort of inflammation in the body can show up in the eyes. So any sort of autoimmune condition. So that's why it's so important to have an eye exam. We've seen many students here who come in, they have 20/20 vision. They don't have any complaints at all. And with the dilated eye exam, we diagnose systemic conditions and fortunately have been able to save lives because of that.
Oh, that's really important.
Yes.
And so how often should students come for an eye exam? Is it every year, every couple of years?
Yeah, every 1 year. Come on in for an eye exam, and then once you're here, some people I'll say, 2 years is fine, and then others I'll want to see them sooner to follow up on a certain condition.
Okay, got it. And how does a typical eye exam appointment run?
So you come on in, we check the prescription of the eyes, look at the health of the front of the eyes, and give eye drops to dilate the eyes, and then check the health of the back of the eyes. We can do a contact lens fitting at the same time. We do a lot of fittings for new students who are new to contact lenses. And then we include a training as well, teaching how to insert and remove contact lenses. I'd say an eye exam takes about an hour. If there's a contact lens fitting and training, it can take about 2 hours. Expect for the eyes to be dilated. And what that means, it's a common question, is that the pupils are opened up to check the health of the back of the eyes. So this does cause blurry vision for about 4 hours and sensitivity to light. Oftentimes if a student has an exam or something like that, that could get in the way. So make sure to schedule the appointment around tests and exams, or maybe even later in the day. Keep in mind that the eyes will be dilated for about 4 hours.
Okay, that makes sense. I think those were all the questions I had. Were there any tips that you wanted to add for the students here at UC Davis?
Yes, thank you so much for all the great questions. So there are many tips for healthy eyes. One thing is to take breaks when on computers and digital devices. Every 20 minutes, look 20 feet away for 20 seconds and blink the eyes. We blink about 60% less when we're on digital devices. Another tip is to wear sunglasses outside to protect the eyes from UV light. It's also important to have a healthy diet and lifestyle. So drinking water, sleeping is helpful for dry eyes. And also, some caffeine is okay, but making sure that you have enough water. A healthy diet is also useful, so reducing fried and fatty foods, having fruits and vegetables in the diet is important for eye health. The most important thing, though, would be to have a comprehensive eye examination. We can discover more than 270 diseases in the eyes, things like diabetes and hypertension and multiple sclerosis and autoimmune conditions. Even if you don't wear glasses or don't have a prescription at all, I would encourage you to come in for a comprehensive eye examination. With a comprehensive exam, we evaluate for conditions on the front of the eye, the back of the eye, glasses, contact lens prescriptions. We do a lot of teaching for new contact lens wearers as well. We can also provide recommendations for safe and healthy products to use in and around the eyes.
Thank you for watching Aggies Talk Health. This is your host, Aruna Nannapaneni, and thank you so much, Dr. Barnett, for being with us here today.
Thank you so much for the opportunity. It's been great fun.